This is talking about fetal circulation. When a baby is inside of its mother's uterus or womb, whatever, inside the mother, it couldn't think of the word. Sorry. It has a different circulation than after it's born, and there's a couple reasons for that. So I'm going to read through this and then I'll discuss it. It says normally the ductus arteriosus. So ductus arteriosus, really cool. What is that? Okay, here's a little non-anatomical diagram of the heart. Right atrium. This is the left ventricle. Okay, so this is the right atrium. This is the right ventricle. Excuse me. This is the left. This is the left atrium. Whew, man, my brain here. Right atrium, left atrium, right ventricle, left ventricle. So here is the pulmonary. This is going to pulmonary circulation. This is going to through the aorta. Okay. Normally, here's the trunk. Here's the the trunk of the aorta. Different valve. Three things come off there. So normally, right about here, you have this connection as a baby called the ductus arteriosus, and blood can flow through here. Okay. Now, let me keep reading. I'll explain what that is. So it's normally the ductus arteriosus closes within a few hours after birth. So what maintains this open is prostaglandin E. Okay. If prostaglandin E disappears, this thing closes up. It says via smooth muscle contraction in the form of ligamentum arteriosum. So this thing turns into ligamentum arteriosum. Patent ductus arteriosus, PDA, occurs. Patent ductus arteriosus means that this thing's staying open when the ductus arteriosus, or the connection between the pulmonary trunk and the aorta, fails to close after birth. Prostaglandin E and intrauterine or neonatal asphyxia sustain the patency of the ductus arteriosus. So in other words, asphyxia and prostaglandin E is what keeps this thing open. Prostaglandin inhibitors, such as indomethacin, acetylcholine, histamine, and catecholamines, promote closure of the ductus arteriosus. So when all this stuff happens, it promotes this ductus arteriosus to close, and then it will turn into the ligamentum arteriosum. Patent ductus arteriosus is common in premature infants and cases of maternal rubella infection. So if the mother had an infection with rubella, that could stay open. It causes a left to right shunting of blood. So in other words, the blood goes from this high pressure system, cross through this, and up into this system here. So left to right. Yeah, there it is. So this is showing a big diagram of the circulation through the baby. Basically what this whole thing does, I'll go ahead and read it. First, let me re-erase this so I can actually see what I'm doing. So it says, in fetal circulation, the ductus venosus allows fetal blood to bypass the liver. You see this? So here's the liver here, and the ductus venosus allows blood to bypass the baby's liver. And the foraminal valley and the ductus arteriosus allow fetal blood to bypass the lungs. So while the baby's inside the mother, the circulation bypasses both the liver and the lungs. Well, the lungs make sense. You don't want the baby, the baby's lungs are supposed to breathe air, not water. And the baby's getting the oxygenated blood it needs from the mother through the placenta. So it also doesn't need to use the liver because, it's getting the blood from the mother, and the liver, will take over after it's born. So that's kind of explanation. Here's a re-explanation of the same thing. I'll go ahead and read through this as well. So it says that blood in umbilical vein has an oxygen pressure of about 30 millimeters of mercury and is 80% saturated with oxygen. Umbilical arteries have low oxygen saturation. So where is the umbilical artery? Here's the umbilical vein. Yeah. So it says there are three important shunts here. One is that blood entering the fetus through the umbilical vein is conducted via the ductus venosus. So blood coming entering the fetus through here is conducted via the ductus venosus. So where's the ductus venosus? There it is. So here's the first one here, ductus venosus. So this guy right here, when it comes through, it's conducted through here and bypasses the liver like this instead of, yeah. So into the inferior vena cava, bypassing the hepatic circulation. So it bypasses this guy. Most of the highly oxygenated blood reaching the heart, this is the second one, so we're right here, foraminal valley. Most of the oxygenated blood reaching the heart via the inferior vena cava is directed through the foraminal valley and pumped into the aorta to supply the head and body. So the really oxygenated blood comes in through here and ends up going from here, because it doesn't need to go down to the lungs, right? So instead it comes through here, and this kind of helps squish it back up this way instead of into the lungs. So it pumps like this, and then it's going to go here up into the brain and the upper body and all that stuff. And the third one here, ductus arteriosus, is the deoxygenated blood from the superior vena cava passes through the right atrium, right atrium, the right ventricle, the pulmonary artery, and where there's a patent ductus arteriosus, through the descending aorta, and so the shunt is due to high fetal pulmonary artery resistance due to the low oxygen tension. So basically, this guy right here, this is the ductus arteriosus. You can see that blood's pumping here, and when it goes here, it just gets pumped up this way, which aids in sending blood up to the heart, and also it does go to the lungs to supply that. But there's a lot of resistance in the lungs, so a lot of the blood's going to go up here to the brain where it needs it. So at birth, the infant takes a breath. This decreases the resistance in the pulmonary vasculature. So see here, these two things, these lungs, had high resistance before, but now when there's air in there, the resistance drops. So that means instead of the blood all going up in here, from this up into here, instead it's going to go to the low resistance. Things always go to the path of lowest resistance, just like water. So it goes here instead, and this ends up closing in a minute here. So in pulmonary vasculature, leads to increased left atrial pressure via right atrial, versus right atrial pressure. So now the right atrial pressure, left atrial pressure is going to be higher than the right atrial pressure. See, this here is this little flap, that the foraminal valley, that allowed blood to flow this way. But this little flap is going to close up and seal because the pressure in here is higher than was the pressure in here. Before, this pressure was higher. So this closes up, and that's eventually going to seal off. And foraminal valley closes. Now it's called the fossa ovalis. Increase in oxygen from respiration, so the baby's breathing now, and the decrease in prostaglandins from the placental separation cause the closure of the ductus arteriosus. So now the ductus arteriosus, which is this guy right here, closes off after the baby starts breathing. Indomethacin helps close the PDA, ligamentum arteriosum remnant of the ductus arteriosus. Prostaglandins E1 and E2 keep the PDA open. And last little point here, fetal postnatal derivatives, allantois, median, I guess they're trying to pinch in this N, I guess, median umbilical ligaments, allantois, median umbilical ligament. The urachus is part of the allantoic duct between the bladder and the umbilicus. The ductus arteriosus becomes the ligamentum arteriosum. We talked about that up here, right there. That's where the ligament forms. The ductus venosus becomes the ligamentum venosum. So the ductus venosus was right here. It turns into the ligamentum venosum. And the foraminal valley becomes the fossa ovalis. The notochord turns into the nucleus pulposus, and the umbilical arteries turn into the medial umbilical ligaments. I think they're trying to compare these two here. So you think allantois is median umbilical ligament, and umbilical arteries become the medial umbilical ligaments. So way to get that together. And then lastly on here, the umbilical vein becomes the ligamentum teres hepatis. The umbilical vein on here, I don't know if they do. umbilical vein, here it is. Umbilical vein, this thing ends up becoming the ligamentum teres hepatis. As you can see, it's going up into the liver. And it's contained in the falciform ligament. All right, that's the end.